Would you like to avoid one of the most common case presentation errors and, as a result, get better case acceptance of Phase 1 periodontal care? Well, then you're in the right place, because that's exactly what I'm going to share, and we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
I had a team member, Jean-Marie. He was my hired gun periodontist, serving both of my practices. And he was awesome. He was terrific in almost every respect. But every once in a while, he'd say to the patient, "We're going to have to start you off with a deep cleaning visit." I almost slapped him upside the head in front of one of the patients one time. When your patient has a periodontal infection and you use the words deep cleaning, you create confusion. It'll be hard to convince your patient why she needs any more cleaning at all. She's wondering, did the hygienist do such a poor job with my cleaning that now I got to go back and get another cleaning? They don't get it. To the patient, it sounds like just the same as the cleaning that they just had, maybe a little bit deeper. And although you and I know that we mean something entirely different by deep cleaning, patients can't help but associate that with routine cleanings, and they get confused. Furthermore, even if they kind of understand that they do need to come back for more cleaning visits, they often wonder, and sometimes they outright ask, why is it so much more expensive than my first cleaning? Some patients lose it entirely when, during their cleaning visit, they're told that they need to come back for a deep cleaning and pay more money. You may even have met patients who mention this as the reason that they left their last dentist. In a moment, I'll share 3 words you can use to replace deep cleaning, 3 words which instantly make it clear to your patient exactly what's wrong and why she's got to schedule the recommended periodontal care right away. If you're finding this gem of what not to say when recommending periodontal Phase 1 care helpful, then I am confident you and your team will enjoy and even laugh at and certainly benefit from my free special report, 24 Things Never to Say to a Dental Patient. To get your copy of the free report, go to freegem4.com. That's freegem, the numeral 4, freegem4.com. Team members tell me it is their #1 all-time favorite gem ever, and doctors say that it saved them a lot of grief and made them a lot of money. Again, to get your free report, 24 Things Never to Say to a Dental Patient, go to freegem4.com. There's a link in the description below. If you're finding this helpful, I'd appreciate it if you could share this with just one other dentist, and it would be amazing if you could click the like button so that I'll know to do more videos just like this one. So what should you say instead of deep cleaning? Simply remove the words deep cleaning when you're speaking with your patient about periodontal Phase 1 care. It's about a different diagnosis, it's about different treatment, it's not a cleaning. In my practice, we use the words gum infection therapy. Write it down, share it with your whole team. Gum infection therapy. Doc, you're working too hard, too many hours, and losing too much money to PPO write-offs. What would your life be like if you could begin to reduce your dependence on PPOs, work less hours, spend more time with your family, and make a lot more money? When I first heard about KPIs or key performance indicators, my eyes would glaze over. Back then, more than 2 decades ago, I was over $1 million in debt. I was being embezzled by my office manager. I came within 3 days of bankruptcy, and I almost lost my home and my practice. A 10% shift in just 2 KPIs, and you could double your income. If you increase your production by 10%, and you decrease your PPO write-offs by 10%, you could increase collections by 20% and potentially double your income. I'll use $1 million practice just for example. You can easily alter the math for your numbers. In $1 million practice, increasing production by 10% puts you at $1.1 million. Decreasing PPO write-offs by 10% of the total production adds more than $100,000 to your bottom line. There's a $200,000 increase in profit. If, for example, you were making $200,000 net on your $1 million production, bearing in mind because of the PPOs you were only able to collect on $900,000 of it, then by adding another $200,000 extra profit, you're now making $400,000 income. You've doubled your income. How would adding $200,000, even $300,000 change your practice? How might it change your life? Over the last 20 years, Elizabeth and I have made Freedom Summit, aka GG12 coaching, available to dentists who demonstrate their commitment to serving your patients at the highest level, creating an environment where your team members thrive, and a level of practice that rewards you with the financial freedom to live the life and the lifestyle about which you've only dreamed. Your journey begins with one step, the roadmap to success. It's a process through which you'll learn about your practice and the hidden opportunities right under your feet. During the Roadmap to Success journey, we'll be able to point out specific untapped opportunities in your practice and dive deep into the details, including your untapped financial potential. After our analysis of your practice, you'll have an in-depth, complimentary, one-on-one Roadmap to Success consultation. It's during that consultation that you'll gain a clear vision of what you can do for your practice and what Freedom Summit coaching can do for you. And at that point, we'll both have a better feel for whether your practice and Freedom Summit are a good match for each other. If we agree that there's interest and opportunity and that we're a good fit for each other, we'll invite you to complete an application to the program. Regardless of the result of that meeting, you'll know exactly where in your practice the biggest opportunities lay waiting to be mined. As part of your complimentary Roadmap to Success journey, we'll perform a free in-depth analysis of your practice. A free one-on-one Roadmap to Success consultation via Zoom, where we'll discuss exactly where in your practice lay the biggest, easiest to access, untapped opportunities for rapid revenue growth. You'll also have the option of getting back on another Zoom conference for one additional 30-minute call. You'll receive free a detailed 8 to 10 page step-by-step written analytic report, a free copy of my book, Confessions of 116 Dentists Who Reignited Their Passion for Dentistry. You'll also get for free 3 steps to leave your worst blood-sucking PPO, keep your patients, work less, and make more money. You'll get the video and the free special written report. And one more free gift just for taking the Roadmap to Success journey. You'll receive the video, How to Add $250,000 worth of fee-for-service new patients in just 60 days without spending a dime on advertising. If you'd like to get the very most out of your practice and your life, as well as create financial freedom for yourself and for your family, take your very first step on your complimentary Roadmap to Success. Learn how Freedom Summit could change your lifestyle and your life. Go to gems12.com, that's GEMS, the numeral 12.com. There's a link in the description below. And remember, you're only one gem away.